Hi everybody, this is Dr. Andrew Scanamea from Andrew MD, where our mission is to help mom and dad live longer and better. Today we have a very important healthcare topic, and that's memory loss. At the end of this video, you will be able to determine whether or not you or your loved one has a significant memory problem. At least 50% of people at 65 years old will complain of memory problems. They will say that they cannot find words properly, they will have a decreased reaction time, they have lost their keys, or they may go into a room and not know why they were there. These are not significant memory problems. You can do certain things to make your memory sharper. For example, you can get out of the house and volunteer, very important. Number 2, exercise your mind. Reading, writing, doing crossword puzzles are very important. Maybe even learning a new language. Number 3, exercise your body. Walking and calisthenics are also good activities. Number 4, sleep properly and eat right. Respect sleep hygiene principles to get a good night's sleep. And number 5, feed your soul by either reading the Word of God or praying. Yes, at Andrew MD, we believe that there should be a balance between body, mind, and spirit. So what are some of the symptoms of more serious memory complaints? In general, there is more than just forgetfulness. There are serious gaps in the memory. For example, they may have had an appointment and missed it and just deny the fact they even had the appointment. Or they may have gone to a restaurant, had something to eat. When asked about it, they cannot remember and just deny the fact they even went to the restaurant. In general, they try to cover the gaps in the memory by denying the activity. They become, number 2, they become less familiar with certain normal activities. For example, driving. They get lost around their own home. They may have bills piling up that they usually do, or they may burn stuff on the stove. Number 3, they lose a skill. For example, they used to play chess, now they do not know what the chess pieces do or what they're used for. Or they may be a golfer and do not know what club to bring to the putting green. And number 4, there is usually a behavioral change. For example, mom may be more anxious, dad may be more depressed, or there may be some paranoia. Dad may think that mom is trying to kill her, or that the milkman has become a terrorist. One big question that caregivers have is always whether or not mom and dad can live alone safely. In general, there's no right answer. Most older people need to be seen on a daily basis. You always have to remember that if mom or dad gets sick, their memory will get worse. For example, if they have a bronchitis or a urinary tract infection or simple constipation, they will need to be taken care of on a daily basis until they get better. What is the common denominator of all these problems that will make your memory worse? Number 1, the poor choice of medications. For example, the use of a long-acting sedative like Xanax along with Tylenol PM, which has Benadryl, will make your memory worse. Please see my video on the top 10 medications not to be used in older people. That will help. Number 2, excessive alcohol use. That will make your memory worse. Number 3, social isolation. If mom or dad is not getting out of the house, they will have a poor memory. Number 4, poorly controlled medical problems like uncontrolled high blood pressure or uncontrolled diabetes or poorly controlled heart failure will make your memory worse. Number 5, poor sleep. If you do not get a good night's sleep, or you're one of the people who have sleep apnea, 30% of older people have sleep apnea, this will make your memory worse. And number 6, if you have a behavioral issue or psychiatric problem that's poorly controlled, like anxiety, depression, or paranoia, you will have worsening of your memory. This is Dr. Andrew M. Scanameo. Thank you for your attention.